Kimberlee here with Specialty Care Management and Reiki and Coaching. Hope you're off to a fabulous day. You may know Specialty Care Management best for our dialysis solutions. Most folks are going to put us in a cost containment kind of bucket, although you won't hear us describing ourselves as a cost containment company. Cost containment isn't important, but it's just a piece of this whole pie of risk. And we do view risk and risk mitigation in a very holistic manner. Cost containment is a robust part of that risk mitigation strategy. Saving the most money on high cost catastrophic claims like cancer or dialysis, if you're looking for the most robust solutions, it's to look upstream and not need those services in the first place, or catching it early enough to make sure that it's treatable and that's going to have a successful outcome. That always yields to a lower cost for your groups. Today, I'd like to share with you a success from one of our Health Reach 360 members. Let's see, maybe if I pull it up here. Meet Terry, our truck driver. This member, he's a 58-year-old, sorry, I'm going to make you dizzy here. He's a 58-year-old long haul driver. And these are some of my favorite folks to work with. They have a lot of challenges in terms of maintaining a healthy lifestyle. Indeed, this member was not happy with how he looked and felt at 5'9" and 287 pounds. And he had been trying to make some changes in his lifestyle to improve his health. 5 years prior to working with the Health Reach nurse, he had quit smoking and reported that, snacking really helped him to deal with some of those nicotine cravings. But he wasn't happy with that weight gain that he'd experienced as a result. He did claim some late night snacking was probably one of his problems, and a sedentary lifestyle. Of course, with his long hours on the road, really, after a long day, he said he just didn't have the energy or the motivation to really do anything physical, although he had thought about exercise. He was worried about being diagnosed with diabetes, said that his provider told him he had a touch of sugar, borderline diabetes, and we hear that a lot. Although this member's A1C was 6.4 when we started. This member also had a heart history, coronary artery disease, that's your CID. He had heart disease with a history of having 2 stents. He had hypertension, high cholesterol or hyperlipidemia, and was found to have 13 gaps in care. This is really significant, and this is a classic of who those members are that are a great fit for our Health Reach 360 program. He had moved a little while ago and just hadn't found a new PCP. And as mentioned, he really wasn't satisfied with how he looked or felt. Our nurse coaches here with our Health Reach 360 program are highly skilled with some of the complex pathophysiology that affects some of these members. We use motivational interviewing and coaching strategies to really help these members uncover their own goals and how to put into place practical solutions and strategies that they can maintain over the long term. We teach on the pathophysiology that's involved and how that comes into play and how this member feels. Again, with this member, we want to support his goal of continuing to avoid smoking, but really to help him see how the snacking kind of filled a hole and how can we explore other ways to fill that hole that he was filling with snacking. Exploring strategies practical solutions that he can put into play to help him improve his diet and movement into a very busy schedule also can help him deal with some of those cravings. The nurse also worked with him to help him find a new provider for healthcare. And on meeting with his new PCP, was diagnosed with gout. And of course, then the nurse launched into teaching how that also comes into play. Gout is also a significant driver for things like kidney disease. Those stones, those uric acid crystals, don't just form in joints. They actually move through the bloodstream and they can do some serious damage to the kidneys and other vital organs. So this is a really important aspect of this member's care. So the nurse was able to educate, able to help provide tools that he could refer back to really help him understand and retain that teaching. Reviewing gaps in care and helping him figure out, strategies to help make sure that those gaps are closed led to almost $13,695 in savings just from closing gaps in care alone. This member loves his new PCP, and because of the nurse helping him figure out how to really communicate with his doctor, really helped him get more out of those doctor visits. He says, I really listen to my doctor now, and I know what questions to ask. That's something significant that we find most of our members really benefit from in terms of furthering the partnership that they have in place with the doctor. That's going to help them, not just in the time that they're working with a nurse coach in a Health Reach 360 program or a CKD management program, but to help them in the years to come. 11 out of 13 gaps in care were closed as a result of this nurse coaching relationship. One of the strategies that they uncovered together was to put an inverter into his truck. So now as he's driving down the road, he can smell his soup or his steak or whatever he has cooking. And that has really helped him improve the quality of his meals. He's able to eat smaller portions and, less red meat out and about. And he even reported replacing his sweets, in particular, his breakfast donuts, replacing them with more fruit. In particular, he really liked his apple slices. He's looking for more ways to be active and found that he really feels better as he gets out and jogs around his truck, walks around his truck, especially as the weather's nice. Interestingly, and one of my favorite stories here was when he told the nurse, my wife looks at me differently now, and I feel so much better too. He's lost 35 pounds so far. That's huge, not only in terms of helping this member have that light bulb moment where, oh my gosh, I love it when they say things like this. I can't believe this stuff works. And that they really take control over their health. He's driven his A1C down from 6.4 to 5.2. He's avoided a diagnosis of diabetes, which is huge in terms of cost savings. And you're not going to see that reported with our Health Reach 360 program because he didn't have a diagnosis of diabetes yet. One of my favorite sayings is that the truth is good enough. We don't need to hype stuff up. You're not going to find any inflated savings reports in our Health Reach 360 program. We really put a lot of value on integrity, transparency, and that impeccable level of trust that we have in making sure that the savings were reported, they're very hard. And so the only savings you're going to see reported on Terry or members like him is this $13,695. However, there's a whole lot of other softer savings. Not only is he staying off of smoking, but he's avoided diabetes. That saves your group thousands of dollars every year. He's also keeping in mind this member has a pretty significant heart history already. Diabetes plays a huge role in terms of intravascular health. That high sugar content, highly inflammatory, does a lot of damage to the inside of the blood vessels. He would have been at a huge risk for not only kidney disease, but other more complicated heart issues. He tells the nurse, thank you so much for all your help. As remarkable as these stories are, not only the impeccable integrity in terms of the savings we report, but we also, in relation to one of our primary, pillars here at Specialty Care Management, is this concept of stewardship and really being responsible with your group's dollars. These members don't stay working with our nurse case management program forever. This is a specialty program. Our average length of stay for our members here is 6 to 8 months. This is a unique strategy for population health where those nursing dollars are spent to help a member become, instead of this emerging risk, instead of being this person who doesn't look bad now, but is fixing to get ready to be your group's biggest spend. We know that. We know it's coming. Instead, we can help this member come back into a low to moderate risk in the group. Those members are best served with a reminder and somebody looking in the background at claims, firing off a message to their provider. This member is missing a few gaps in care. He's missed filling his cholesterol med for the last, couple of months. I want to have a conversation there. They benefit from that behind the scenes work. That nurse coaching time is billed at $125 an hour and is reserved for those emerging risk members. So it's a phenomenal program in terms of value that's provided. The ROI, our savings here, an average of per member is a $4,000. Yeah, $4,000 per participant is our average savings across our book of business with our Health Reach 360 program. That's phenomenal. An average savings of 5-to-1 on some of these groups, which is really pretty phenomenal. And cost effective as well. If you have questions, if you want to know more, feel free to reach out to any of us here at Specialty Care Management. It's our favorite thing to talk about, and make it a great day.